Do you find that, is there more, it seems to me like there would be more healing cells from the bone marrow than the fat. Is that the case? Or?
Yeah, theoretically there should be, but again, we're looking at a scar reaction. So whatever's going to really irritate the most and stimulate the body to now have what you put in there, plus the body's going to react to it. Mm-hmm. So the body's going to see that in there and say, oh, what's this? It's going to send an extra amount of the cells to heal also. So it's this bonus reaction, basically, what you're getting. So it depends. It's hard to really know.
Eventually, you can get the same amount of healing cells from the fat, from the belly, or from the pelvis. If you really want to turbo boost, take it to the next level beyond the PRP.
Yeah, I don't really know how you differentiate, because every person's individual how they respond to it. So if you say, well, I definitely have cartilage issue that I need to fix, then I would go more with the stem cells or the pelvis, BMAC. I would think the lipogems would be more of a soft tissue.
Lipogem is the fat.
Yeah, lipogems would be the fat from your abdomen, more of a soft tissue, or not labrum cartilage, but joint cartilage. I think maybe more benefiting from that, like in a big weight-bearing joint like the knee or the hip. You do the lipogem. I think that might help someone with a bad arthritis there, to avoid a surgery as long as possible.
Interesting. And then the last option would potentially be to get stem cells from another outside of your body.
Yeah, so there's stem cell banks that are very regulated. Make sure there's disease-free. People may or may not know, when you have a baby, you sign all these papers to donate your placenta, or stem cells, umbilical cord. And this is pretty much where they're getting them then. So, and it either comes in a dry ice, next day, mail, liquid that you then inject right away, or it's freeze-dried powder you have to reconstitute and then inject it. So the availability is very restricted. There was even a moratorium on it, again, until this past fall. You couldn't even get the liquid one until this past fall. Again, now the places that used to supply them went out of business because of that. So now there's new suppliers that are unfortunately more expensive because now there's demand. But again, I find that's great for hip or shoulder labrum injuries. Is when I find that's the best, that liquid stem cell mix.
Just to summarize, as far as regenerative medicine and options. So first of all, the indications. So if somebody has potentially arthritis, whether it's in the knee or hip or really anywhere in the body, tendinitis, inflammation of the tendons, or even a tendon tear, like an Achilles tendon tear or a partial rotator cuff tear.
Yeah, these chronic tears, as people call it, tendinosis.
Very interesting. And what are the other indications that you find?
Yeah, so if someone has the joint cartilage that we were just talking about worn out, you could potentially give them enough time so someone says, you know what, I need something. I can barely walk. I'm limping. I have my son's wedding in a year. I don't have time to have knee replacement. Can you do something to hold me over? So they maybe can do one of these just to make their knee or their hip or their shoulder, whatever the arthritis condition is, last at least till that.
Interesting. Yeah, I find that it can be used really just about for almost any issue. I mean, we've been using it for rotator cuff repairs to supplement the healing, to increase it. We've been using it for people who don't want a rotator cuff repair, and if the tear is small and their function is reasonable, sometimes we can use it. So going back to the options, so the indications are really wide variety: arthritis, tendon tears, cartilage tears, most or many joint issues. But the main ones are the arthritis, the tendinitis, partial tendon tears, or even some full tendon tears. And then the options, the most common one seems to be the PRP, where the blood is drawn from your own blood is drawn and then spinned, and then the real quality healing tissues are then injected. And then you have the option of using stem cells, whether it's from the pelvis, which is probably the more common ones. That's the one I've done, but I've never done the other option that you mentioned is getting it from the fat from the abdomen, which is really interesting, very interesting. It's extraordinary how fast this technology is moving and the options are. And what we're doing is we're using our own tissues. We're using our own healing cells. It's really incredible.
Yes, it's great. And there's another spin also. So in the pain management world, you can actually do these injections to help with people's spinal issues too. Again, same thing. worn out cartilage between the bones in the spine, because essentially that's joint cartilage as well. Everyone thinks, oh, my joints are my knees and my shoulder and my hips. They forget the spine are a whole stack of joints. Mm-hmm. So this could help there to glide the joints, maybe, regenerate some, muscle tears that have been developing over years with bad posture and things like that. The pain management
how about
world has this also.
It's really extraordinary. So how about things like stenosis, like degenerative stenosis, arthritic constriction of the nerves and the spine? Is that been used for that?
I mean, people are trying it because surgery, as you know, is very, aggressive and possibly not, the greatest outcome or no outcome to do these cage procedures and things for stenosis. So people are trying it, and essentially it's if you get better movement, I think that's really how it helps, because now you have better joint fluid, joint cartilage between the bones, and now you're moving easier. I think now the nerves essentially have more breathing room. I don't know if it's really regenerating nerves, but it's regenerating action in the spine that's more comfortable, so now you don't have this locked up spine.
Great point. It's the movement, and that applies to all joints. It's the movement. If you get that flexibility back, all of a sudden the pain seems to lessen. All of a sudden the function improves. People are happier when they're able to move. I mean, that's really the focus of life, is movement. Have to move. That's extraordinary. Yeah. So I'd love to hear a case, if you have an interesting case that you used it for.
Yeah. I mean, I'm
sure you lot. I'd love to hear more.
Yes. And I have great follow-up on a specific case I'm thinking about. So, I have a lot of, active, people and high-level athletes. One in particular was just, told them they had a large labrum cartilage tear in the shoulder, and they was like, I'm not getting surgery. Figure it out.
He had, it was a he, I presume?
Yeah.
It was a labral tear, which is a cushion of cartilage in the joint, in the ball and socket joint, that's important for stability.
Yes.
And the labrum was torn. It was a young athletic person, and they did not want surgery.
Yeah, high-level athlete, didn't want anything going for a big deal. So I said, well, PRP, it might help. But, it would be best if we just went right to stem cells, that liquid version we were just talking about before. And because I just found that, I don't know if there's studies that support it, but anecdotally, I just find that definitely seals the deal.
Which stem cell was it again?
The one that comes dry ice overnight, already still liquid from the actual placenta.
Not his own stem cells, it was from the bank.
Yeah, I found that would be just really the best way to, again, it's, medicine's a lot of evidence-based research, and somehow the studies just don't show PRP and stem cells what they really do. I think if you live it and you see how people return to function, you realize, I don't know why the study just showed kind of equivocal results. It's obvious, and you get an MRI and everything's healed, that something good happened. So that's the case with this patient. That's why I like this one specifically, because they were a long-time patient and got to see them for other things, and then all of a sudden had another shoulder injury years after that stem cell, which normally you don't get a labrum of that size of a tear fixed surgically. It doesn't go away. You'll do an MRI, 20 years later you still see it. So in his case, the MRI was redone for a new shoulder injury, and normal labrum, it was a new injury of the shoulder. So it showed that it actually did heal it. And that was just, maybe 2-3 years after that injection.
But I've never seen that. Like, since we're talking about labral tears, it's a good topic to touch on as well. But I've never seen it, like where the labrum is healed. So once there's a full tear, unless it's surgically repaired, I've never seen that it be fully healed.
Yeah, it was fully healed. MRI, normal labrum.
That's a case study.
Yeah.
So that we can help more people and reach more people, please be sure to like our video and subscribe to this channel. Thank you so much.